The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella, and I'm here today with Rob Sapero, our office manager, and our special guest, Dr. Ben Erb, who's one of the lead doctors at APMR Miami. You have to check us out at our website, apmrmiami.com. What's up, gentlemen?
How's it going?
Hey, glad to be here.
Yeah. Got a great show today. We're going to talk about different ways that people approach back pain. And this could be any type of pain, knee pain, shoulder pain, back pain, but there's pretty much two reasons why people come to see us in our office, and one of them is because they want to get out of or reduce pain. And the second one is they want to reduce performance. And we often find that they've had a difficult time achieving those goals. They've tried different types of modalities, therapies, and they become discouraged. And the two questions that we always have for our patients when we start out, number one is your joint healthy or unhealthy? You know, some of that is dependent upon how you feel. A lot of that is based upon performance, but the really only true way to diagnose whether joints are healthy objectively is to take an x-ray. So Dr. Ben, what do you know, when we look at x-rays of the lower back and knees and shoulders, what are you drawn to immediately? What do you look for to classify patients as having mild, moderate, or severe risk of surgical intervention?
Well, there's a number of things, but the very first thing I look for is really what a lot of chiropractors will look for, and even medical doctors, is a proper curve in the spine. And the reason is that is what protects your joints over time and keeps them healthy. It acts as a shock absorber or a spring, and not so much as a pole vault or something that's going to cause compression over time. Mm-hmm. That's the first thing I would look for.
And that's most commonly lost nowadays, right? The primary curves that you're referring to in the spine are formed with development, and when a baby goes from sitting with assistance to finally going on the floor and crawling. They lift the head up and the belly droops, and they get that curve in the lower back and neck. What are some of the common things that we see nowadays? We talk to our patients all the time, that common activities that lead to loss of those shock absorbing curves.
It's really a lot of sitting, people not being as active as they possibly could be, and believe it or not, encouraging kids to walk and stand at an earlier age, as you alluded to before, is those curves are developed as you're growing, and the cross crawl mechanism is what helps them happen. But sports, lifting weights, believe it or not, leading a healthy, active lifestyle is stress on those joints. And if you don't have the proper curve in there, it's going to degenerate faster than if you did have a proper curve in the spine.
Yeah. Have you seen any changes over the years as cell phones become more prominent in our lifestyles? What kind of changes are you guys seeing in, x-rays in younger 20, 30-year-old patients?
And what I would tell you, I think that's even well known across the nation as text neck, is what you're alluding to, and it's really losing the curve in your spine and your neck. That, again, is a shock absorber. That's typically the first one to go. And again, sitting in front of a computer, reading text messages, sending text messages, all those things, wear it out faster, where the person that's 14, 15 years old nowadays is going to have the age, the neck of an age of a 40-year-old male or female, and they'll look the same.
Wow, that's crazy. I mean, if you really think about that, to be in your 20s and have the arthritis or the structural changes. And there's another thing that's been popping up. Isn't there something around, talking about the cone in the back of the head?
Think about what we just said, though, too. Someone would be in work for 15 to 20 years, sitting at a desk or a computer, and develop different types of postural changes from using a typewriter, from writing at your desk, from using a computer. Now we're seeing that because kids are using cell phones and iPads from the time that they're pretty much functional to the time they get to be 18 or 20. So that 20-year gap of work-related stress we're seeing before they even get into the workforce.
Call that again, text?
It's called text neck. And what text neck is, it's a complete loss of the normal curvature or shock absorber in the spine that leads to progressive degeneration. So a couple of things we should mention. Degeneration is typically thought of, considered to be something that's only associated with older people. And it's just not the case. It's not even age dependent anymore. And there's two types of degeneration that we need to be aware of. One is called hard tissue degeneration, and that involves bones. When bones degenerate over time, they expand in size. So if you have an expanding bone in the spine could put pressure on a nerve and cause chronic severe pain down an arm, down a leg. If you have expanding bone into a joint space of the knee, it's going to damage the cushion in the knee and cause damage to the meniscus and cause, again, chronic pain. Then there's soft tissue degeneration, which is very common in younger people. Soft tissue is the support structures that hold the spine up, that hold the body up when we're walking. Those are the discs in the spine, the meniscus in the knee, the labrum in the shoulders, and in the hips. And when those structures degenerate, they actually get smaller in size. So if you combine the two, an expanding bone and a decreasing or shrinking shock absorber, you have conditions that produce pain, whether chronic or whether acute, meaning brand new severe pain, both of which have to be treated. The long answer to your question is when we see degenerative changes because of text neck, we actually see spurs developing on the back of the skull, the same way that we would see spurs develop on the bottom of the foot when people overutilize progressive training for marathons. They'll get spurs on the bottom of their heels, running on the wrong surfaces, running with bad shoes, increasing intensity or duration too quickly. It's so strenuous on the tendon and ligament that attaches to the bone that the bone actually pulls away from itself. And we're seeing that even on the back of the neck in these young kids. Now, you mentioned pain being one of the symptoms from these structural changes. What other symptoms can be present? Because there's other stuff besides pain that can be giving you a good indicator that something's wrong. Just like having a cavity, pain is not typically the first thing that shows up. It's usually sensitivity to hot, cold, and things like that. That's for teeth. And the reason I use that analogy, most people can relate to that. When people wake up with numbness, tingling, radiation down their arms, in other words, electric-like sensations down their arms, they think they slept on their arm wrong. That could be the case, and it could not be the case, because if it continually happens, what's the odds that you sleep in the same position, putting pressure on your arm in the same exact way? Not very likely. But if you wake up with numbness, tingling, burning in the hands, arms, forearms, shoulders, there's a good chance that there might be an impingement somewhere, whether that's in the neck, pinching on a nerve, whether that's in the shoulder, so on and so forth. But it's never normal to have these type of symptoms. Yeah, it's an excellent point. And as far as other joints in the body, what are some of the early warning signs that something is not okay? You'll typically see athletes favoring a certain side, a certain position, a certain posture. They avoid certain stressful exercises. A lot of our CrossFit athletes will develop discomfort when they're pressing up overhead, when they're bending forward doing deadlifts. The average athlete that trains 3 or 4 times a week, that could be mom, dad, that could be anyone, will typically have pain with sitting at their desk for extended periods of time. And they just attribute changing the position to fixing the problem. And many times that is definitely not the case. When we take the x-rays, again, and we see these changes that involve degeneration and match them with the symptoms, that's how we develop the appropriate treatment plans. So when you're out there listening and you have back pain or neck pain or knee pain, you're already far down the road of degeneration if those symptoms are already present. And the biggest thing that you need to do is find out, what do you need to do to treat it? Is it a part of the body that's going to get better over time, or is it going to get a part of the body that needs help to get better over time? Because what we typically find is that parts of the body that are in pain, there are a couple of different pathways that people go. Number one is they kind of just wait and see, right? And waiting and seeing is a quick pathway towards some sort of an intervention. Oftentimes that's going to be surgical when it involves a weight-bearing joint. Why? Because as symptoms increase, patients typically will take a medication, right? And they don't listen to their body that pain is an indicator. It's a warning sign, A, not to do the exercise, and B, that their body is attempting to heal, but it doesn't have the materials to do that. Mm-hmm. So they'll typically take an anti-inflammatory to mask those symptoms, and they continue with the exercise that's causing pain. And eventually, their body breaks down to another level, and they wind up in more chronic pain. And they'll resort to not taking action to fix it, but a different drug. And they'll typically wind up with a muscle relaxer and eventually some sort of opioid or cortisone. And I wish I could say that that would all be okay if any of those medications actually fix the problem. But all they do, as you mentioned, Dr. Ben, is they treat the symptom. It does nothing to treat the cause of the problem. So we're here today to talk about, if you have these types of conditions, back pain, knee pain, not only do you want to get rid of the symptom, but you got to treat the cause. If you want to keep the joint and you want to keep yourself healthy and you want performance for the rest of your life, you have to fix the cause.
So what should be the first step?
First step towards healing is making an appointment.
That's right.
Right? Go to our website, apmrmiami.com, call the office, find out what services that we have that can help you. The first thing that we do with the patients, though, is we have to discuss with them and grade what phase of healing that they're in. So they're either progressing with healing and the injury is recovering, or if they've made the appointment, they're stuck. There's 4 phases of healing that cellular regeneration encompasses. Number 1, it's the injury phase. So when you have an injury, you have inflammation. And inflammation is different in different people. It's pain, it's stiffness, it's fatigue, it's low energy. But most commonly, we'll see inflammation and pain as being synonymous. And when you have inflammation and pain and it's been there for 2 to 3 months, then that condition is chronic and moving into the degenerative category. So once you have phase 1 of an injury, there's inflammation and pain. The second phase of recovery when there's an injury is the stem cell migration phase. The first line cells that respond to inflammation from damaged cells and tissues are stem cells. They migrate to the injury site. So you think of these little cells as little delivery carriers or little delivery trucks or cars from CVS or Walgreens, bringing whatever you need to get better. So it's like a pharmacy delivery person. Stem cells transport growth factors, enzymes, different types of molecules to damaged cells and damaged tissues. And when that happens, when the second phase happens and stem cells migrate to the injury site, you move into the transfer phase, which is phase 3. Stem cells transfer these nutrients, these growth factors, these enzymes and molecules to the damaged cells and tissues as long as oxygen is present. And when that happens, you move into phase 4 of healing, which is regeneration. Your body heals and the inflammation goes away. So if you have pain, you're stuck in phase 1. So you may have had stem cells that migrate to an injury site, but they can't even interact with that damaged tissue because the injury sites that we're talking about specifically today, discs in the neck and in the lower back, labrum in the hip and in the shoulder, meniscus in the knee, they don't have a blood supply. So if they don't have a blood supply, there's no oxygen present and they can't transport the nutrients that these cells need to recover. So they're chronically stuck in phase 1 inflammation. And the goal is get them out of it. And how do we do it? So we're going to talk a little bit about, in the second part of the show today, how do we treat specifically a weight-bearing joint like a lower back, a neck, a shoulder, and specifically a knee. How do we move people from phase 1 inflammation into phase 4 regeneration? We'll talk about that right after the break.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788.
And we're back talking with Rob and Dr. Ben about the causes of unhealthy joints over time, patients being stuck in chronic pain, which is phase 1 inflammation, trying to get patients to move into phase 4 healing and regeneration. And if we're going to talk about recovery, there's pretty much 3 secrets to healthy joints that we're going to talk about. One involves fixing the circulation problem, getting oxygen to these cells and tissues of the body that don't have it once we're done growing. Specifically the discs in the lower back, the labrum in the shoulders and the hips, and the meniscus in the knee. So step number 1 is we got to improve circulation. Dr. Ben, what's your favorite modality that we use to get oxygen around these tissues so they can start to regenerate and heal?
Laser. I would have to choose laser if I had to choose one.
You were one of the first people in our practice years ago that were talking to us about lasers, low-level lasers, high-power medical lasers, specifically, keeping it in a way that the audience understands us. How does that get oxygen in and around unhealthy tissue so the body could start to regenerate and heal it?
Well, it really just excites the cell. In other words, it gets the damaged cells healthy enough to either begin to, number 1, receive everything that your own stem cells are bringing to them, and number 2, to start producing its own nitrogen oxide to help itself and its neighbors around it, to create an environment that's healthy enough in order to regenerate and proceed from there. The way that it does that on a little more scientific level is it activates your mitochondria, which is like the generator of the cell. So if God forbid a hurricane hits here in Miami and we lose power, what do? You turn on your generator, and that's what we're trying to do for the cells.
Yeah, so that's an excellent point. You mentioned that keyword nitric oxide. That is actually a gas that's produced by the inner wall or the middle wall of the blood vessel, and it's a gas that causes blood vessels to get bigger, to enlarge. So when you can move more blood into an area where cells are damaged, you're going to be able to have those damaged cells and tissues come in contact with oxygen. And as soon as a tissue comes in contact with oxygen, it begins to heal. So there's other ways that we can do it in the office. We use something called shockwave therapy, which is a very strong sound wave that does 3 things to blood vessels. It unclogs them, it makes them stronger, and it creates new ones. So if you can do any of those 3 things in terms of blood vessel strength and size, move those in and around damaged cells and tissues, your body's going to heal. And lastly is we can inject it. I mean, we've done shows talking about ozone and prolozone, and essentially injecting that substance in and around a damaged joint, we can stimulate the body to heal that joint just like every other part of your body does. But that's only part 1, getting oxygen to those tissues. Number 2 is if the condition is degenerative and we've lost cells, we got to add more. We've done shows on tissue grafts that contain these mesenchymal stem cells, giving your body more of what it needs, unlocking the potential of your own stem cells. But we also have to, I want to take a minute to just address the fact that you have to structurally fix the body as well. So if you have unnecessary stress on the joint before or during the time when we're getting these joints to repair themselves, we don't want to put the same amount of stress on them that caused the injury to begin with. So we have to unload or decompress. And we'll talk a minute about spinal decompression. We were really fortunate and happy enough to partner up with our office with Disc Centers of America recently within the last 2 weeks. And our office is now proud to be associated and affiliated with Disc Centers of America Miami. So you're going to be able to go on the website and look for us there as well. And specifically what we do is we treat these conditions involving spinal compression that cause herniated discs, bulge discs, which are just early onset disc injuries that will lead to herniated discs that produce all of the symptoms that you discussed earlier, Dr. Ben. Leg pain, arm pain, pain with coughing and sneezing, pain that forces you to give up activities that you love to do. The best part about this type of therapy is it's non-drug, non-surgical, and people get better. 80 to 90% of the people that we work with non-surgically get back to doing the things that they love to do. I know you're passionate about this, Dr. Ben. You've been big on spinal decompression since you joined the practice many, many years ago. What's the best part about actually doing the procedure when you communicate with the patients?
The best part about doing it is that it doesn't hurt. Non-surgical spinal decompression is there to fix your problem. And all you have to do is lay there and let the machine do its work for you. Many of our patients fall asleep while it's happening, whether it's spinal decompression for the neck or the low back. It doesn't matter. The people are falling asleep and then coming off the table feeling better.
Yeah, because it's such a release of pressure. And I mean, we do it all the time myself. This is actually one of my favorite therapies to do when it comes to treating my lower back. And I know Dr. Ben as well. I think, what was it, yesterday we were just on it after the shift. So, I mean, it's something that we live by ourselves. And kind of to toot our horn a little bit, one thing I love about our office is that we're constantly improving. We're constantly looking for the next best thing or how we can do something better. We never just settle for, just regular decompression. I know we've been doing decompression for a lot of years, but, over the past couple of months, we've kind of retrained ourselves. I know you've gone up to Orlando and gotten recertified on it, and we're really starting to mix it up and getting different angles, getting different positions on the decompression. Now, one thing that I've, done recently, which I loved a lot, is the prone position. Explain that a little bit and why that one is so much of a better pull as opposed to being supine, which is face up.
It's just directional preference is what it's called. And what that means, does it feel better to bend forward? Does it feel better to bend backwards? And that gives us the directional preference. And then really when you go prone means face down. If you were to lay on your belly, face down on the table. If you go prone, when discs herniate or bulge, what they do is they go backwards. So if you're standing upright, they're heading away from your faces. They're heading back toward your rear end. So they go backwards. If you lay face down, where does gravity pull? If it pulls down. So it's called gravity assist theory or phenomenon. And what happens is that gravity is assisting as you're unloading the spine or decompressing the spine, gravity is helping push that herniation back down to where it needs to be.
Yeah. And what would you say the biggest difference is? Because we do get a lot of patients who have inversion tables and they're like, oh, I do this all the time at my house. I do decompression. I got inversion tables. What would you say to those patients that, constantly do decompression during inversion as opposed to why they should come in and do it, with us?
It's a really good question. I get asked about it at least a couple times a week about inversion tables. And the thing about inversion tables is they're not regulated. They're not every one of them is set up the same. Not every person is the same size. So if you were to tip at the same angle and you're 150 pounds and the other person's 250 pounds, who has more pressure pulling on them? Obviously the person at 250 pounds.
Sure.
And more is not always better when it comes to decompression. So there's a really sweet spot in there as far as percentage of body weight that you want to pull at. And I'll tell you what, we're really dialing that in. We're dialing in the positioning, and we've seen phenomenal results lately, better than I could imagine.
Thanks.
So some of the key takeaways from what we're talking about today is when you're in pain, when you're listening out there, first thing you have to do is call. Call the office, 305-598-8788. Set up a consultation. If we can help you, we will. We're not going to charge you for a consultation because we have to know that we can help you first. Second thing is find out if your joints are at high risk. Do you need to do something? Is intervention required? Number two is the joint that's injured, whether it's your lower back, your knee, is it a joint that does not have a good blood supply? If that's the case, we got to get blood. We got to get oxygen into those tissues. There's lots of different ways to do it in our office. You may be a candidate for ozone, prolozone, shockwave, or laser. Number two is if the condition is degenerative, you've lost function, do you need to add more cells? If you're a candidate, we'll let you know. Number three, I want to mention weight. If you need to lose weight, you have to lose weight before these conditions, and so these conditions can become permanent and long-lasting in terms of the treatment. real quick note is that every excess pound of body weight that you carry puts 4 pounds of extra pressure on a weight-bearing joint.
Wow.
If you need to lose 40 pounds, how much weight are you putting on the knees, on the shoulders, on the lower back?
Yeah, absolutely.
So the 3 things that have to be addressed, just to recap, you got to get circulation to the joint, you have to add cells when necessary, and you need to lose weight. That's the 3 secrets to maintaining healthy joints for a lifetime. We're going to wrap it up today. Really happy to have Dr. Ben with us. He'll be here again with us on future episodes. Rob, happy to have you back again and happy to be back on the air. Look for us on Sundays at 9:30 a.m., Wednesday nights at 6 here on 880 The Biz. And look for us at our website, www.8pmrmiami. I'm your host, Dr. Joe Gambardella. Remember, repair, replace, and regenerate. We'll see you next time.